Good morning and welcome to the program Perspectives. My name is Jacqueline Adebija, and you do know that every Tuesdays and Thursdays we like to bring to you updates about a worldwide battle, talking about the pandemic that has become, in fact, the name coronavirus or COVID-19 has become like a mantra worldwide. Every country struggling in their own way to cope with what the world seems to have been faced with. This is a situation that the world has been faced with since 2019, but not on such a mega scale as when we had to face it as one in 2020. And I dare say that we are still battling with the coronavirus in the year 2021. Even though I would say at this point, the level of awareness, if you were to walk to someone and say, do you know the coronavirus? Of course, chances are even the smallest child will tell you that, yes, I know that it is a disease. But what a lot of countries, not just Nigeria, but a lot of countries are struggling with at this time would be misconceptions, the myths or urban, do we want to call them urban legends or urban myths? And this in itself proves, it will prove a great danger to the people if one was to allow it fester. And so without waste of time, I would like to welcome Dr. Ibrahim Yusuf of the department, Ibrahim Jimoh, I beg your pardon, Dr. Ibrahim Jimoh of the Department of Community Medicine at the Barrow Dikko Hospital. He is also a consultant public health physician. Dr. Ibrahim Jimoh, you are welcome. It's great to have you here with us in the studio.
Thank you very much.
Talking about misconceptions that, that are like the biggest hurdle right now in people being able to accept that not only do we have a pandemic, it is a pandemic that is taking out lives. People are practically dropping like flies. These misconceptions are something that we need to handle. So how would you handle in the first place? Because I do know that people who still do not believe that we have a pandemic, that this thing is being fabricated. It is some grand plan by, some world order or something to just subjugate the people. How would you respond to this?
Thank you very much. Good morning, listeners. I want to tell you that the COVID-19 is very real, and I'm going to roll out some figures for you to know the situation the world is facing, not only in Nigeria, world over. About 96.5 million all over the world have been infected. And out of this, over 2 million, in excess of over 2 million have died. In America, which is the epicenter of this COVID-19, over 24 million people have been infected, and we have over 410,000 have died. Followed by India, which has about 10.5 million people who have been affected, have about 152,000 deaths. And Brazil, followed by Brazil with 8.5 million infections, and about 211,000 have died. So, if you follow this thing, you can go on and on. In Africa, we have South Africa, which is the epicenter in Africa, where we have about 1.5 million people infected and about 35,000 people have died. So if you look at this trend, you know that this very COVID is very, very infectious and dangerous. Coming to Nigeria, we have about 114,000 people infected, and so far we have about 1,478 people that have died. So, but we cannot be celebrating Nigeria, because if you look at our data, most of the data we are having is hospital-based data, which is not reliable. Most people are dying at home silently. That is the implications. because the only people that go to the hospital are very few. We call them iceberg phenomenon. So it's only very few people that go to hospital, and coupled with the fact that we have poor health seeking behavior in Nigeria. So most people that are sick, they either go to chemists or look for traditional means of sorting out this, and as a result, people are dying quietly at home. So we should not rely on the figure we are ruling out. It's purely hospital based. And those that are still doubting the existence of COVID-19, so they should go and ask those that have been infected, who have gone through this terrible scenario when they are in isolation center. And one of which I would normally mention is Ali Baba. His video went viral, where he explained what he went, how he managed to survive by the grace of God, where about 8 cylinders of oxygen was used on him before he could survive. And some people got about 20 cylinders of oxygen and they couldn't survive. So the COVID-19 is very real. We have to be very careful. And the non-pharmaceutical interventions is the most effective for now, because we've not gotten the vaccine. People that are still thinking it's government that's trying to make money, please, we should know that COVID-19 is dangerous and we need to maintain all these preventive measures for us to be alive.
Recently, this was about yesterday, the governor of Lagos State, Governor Babajide Sanwo-Olu, had come out to tell his people, because we do know that in Nigeria, I don't know if this is true, but I get a feeling like Lagos is also an epicenter of sorts. So Governor Babajide Sanwo-Olu said to his constituents, Lagosians, that look, even if you are feeling feverish, if you are having symptoms of malaria, please go to the hospital and insist that they should test you for COVID-19. So the question I want to ask now is are we seeing a change? Is this virus beginning to manifest in other ways than, because for a lot of us, when we first started talking about COVID-19, we were talking about, symptoms of like the common cold, respiratory symptoms. But now we're having, the governor saying, look, if you even feel like it's malaria, please go to the hospital and get yourself checked, because the earlier it's caught, the better the outcome of your treatment. What would you say to this?
Yes, thank you very much. What I want to tell people that all these infections, they have cross-cutting features that is not specific to either malaria, typhoid, or COVID-19. So the only way you can know whether you have COVID-19 is to go and do tests. And we thank government for their generosity by making the tests available and free. So in view of the fact that the test is free, people should come forward and do this test. So don't think when you are having fever or cough or mild catarrh or so, and you think it must be malaria. Even when it is malaria, you have to do tests to know it is malaria. You don't just take history from the patient and conclude. It's the test that will reveal whatever that is wrong with the patient. So my appeal to our people, whenever time you develop symptoms, go to the nearest health facility or designated health facility where this COVID-19 is done free. So please make yourself available so that we'll be able to control these infections as soon as possible. Because the earlier we are able to take you out of the crowd of people, the better, because we'll be able to stop the chain of transmission.
Talking about designated centers where this test takes place, where are the designated, recognized places where COVID-19 tests can be done and would be recognized by government in Kaduna State?
Yes, in all we have all the general hospitals in all the local government, 23 local government in Kaduna State are designated center. In addition, and we have it in Barau Diko Teaching Hospital, we have it in Yusuf Danso, and we have it in Rigasa General Hospital for those that in Kaduna Metropolis. Other local government can go to their rural general hospitals for the testing. The lab people are there waiting for people daily, every day, to come and take their sample. And that's what we are currently doing. And occasionally we move to community. when we are doing contact tracing. And anybody we find positives, we line list those that you have had contact with during the period or in the last few days. So in the last 2 to 14 days, so that we track those people and go and take their sample, so that they will be able to know on time who have been infected and who is so lucky that have not been infected. And those that have been infected can easily take out of their family so that they don't infect other members of the family and take into isolation center.
Okay, so we have it at just so that, especially for those within Kaduna Metropolis, so that we're clear. Yusuf Soho,
Barao Diko Teaching Hospital,
and
Rigasa General Hospital, and I think 44 reference hospitals.
Okay, okay, just so that a lot of people are clear. Let's come back to this issue of misconception. Why do you think that it has become such a huge thing? People are saying that it is something that was manufactured by governments worldwide. And how can we handle it better? Now, before I allow you to speak, I must also chip in the part that even people in power, in government, people like that have played in the rise of misconceptions. If you talk about a place like America, we all know what went on in the United States, where the president himself had a really hard time believing that there was a pandemic. And even after he also got infected, he had a hard time wearing, a face mask and just showing the people like, this is real. In Nigeria, when we come to a place like Nigeria, we have the person of a governor, a sitting governor, talking about this thing not being real. How are we going to, how are you as medical practitioners, people who are on the ground seeing what is happening, apart from programs like this, how else are you going about helping people understand that this thing is killing and we need to have even a higher level of prevention than what we are seeing right now?
Yeah, thank you very much. What really wasn't these misconceptions is due to lack of trust between government and its people, and that thing has been going on for a long time. I must confess, but in reality, based on what we have seen on ground, it is clear now that this COVID-19 is real. Yes, based on what you said concerning the American president that was calling the virus China virus at the beginning, and that was what led to the heavy infection rate that was going on in America, because initially it was playing down the virus. When the other countries are closing down their border, they didn't do that on time. And it has been there long time ago that International Health Regulation 2005, that whenever there's a pandemic outside your zone, the first thing you must do is to block the entry. And if at all people must come in, you must quarantine them. That was the initial mistake all the world leaders did. They refused to quarantine people in the government control area. But in Nigeria, what we realized that people were allowing and they were asked to go and self-isolate. And people are now freely moving around without obeying these simple instructions, because it involves heavy government officials, which they think they would not be able to quarantine government. That's what led to the initial pandemic we have in Nigeria. Otherwise, we could be able to curtail it at the beginning. But when you inform people to go and self-isolate, people are very difficult to manage. They go around doing their businesses and as a result, infecting people here and there. So that's why we are here today. Then coming to how we can address the issue of what do you call it? Misconceptions. So that is why government are bringing out this kind of program for sensitization and advocacy. And we are also going to communities to see the community leaders, religious leaders, informing them about this existence of this. So we have a designated committee that we call risk communication team that move around the communities to sensitize people, talking to the community leaders so that to assure them about the real existence of this virus, so that people will continue to observe these non-pharmaceutical measures such as wearing of face masks, maintaining physical distance, because it's a new behavior we have to adopt, whether we like it or not. And this pandemic is not likely to go so, even with the existence of vaccine. It's very difficult, because how many people can we vaccinate that can be vaccinated in 1 year? Where's the money? Where's the resources? So the government has to prioritize who are those that are the high risk at first before they go into other people. So that is the situation we have, and that is what the effort we are taking to address the misconceptions.
You know, there was something you said just now. You said people are very difficult to manage. You cannot just say something and expect people to obey. You know, sometimes you have to follow up. And this is where I come to the side of government. When we first started realizing that, look, the world as a whole is being faced with an issue that is going to be with us for a while. In Kaduna State, we had for instance, the Castelia. They would stand on the road, ensure that everyone had, you know, whether you were in a car or whether you were walking, you had to have your face mask. In front of every establishment, whether public or private, you would have water coming from, you know, from whatever source, preferably one that you cannot touch with your hands, and soap to wash your hands with. However, if you take a walk around Kaduna metropolis today, there are many of those buckets that are empty, no water in them, no hand sanitizers left on tables or wherever for people to access, no hand washes for people who might even want to follow those procedures. And I'm talking even well into government-owned facilities. For instance, I was at Magajingari a few days back. There was no water. There was a hand wash, but there was no water. And so even if when you find out that in a government facility, we have people not taking these measures seriously, how then do you expect private establishments to take it seriously? So speaking to the government right now, I mean, through you, how can we do better? Because right now, even from the angle of the measures government put in place, people are not following those procedures.
Thank you very much. That is a very serious challenge, I must confess. And we have this kind of problem mostly at the local government. And we have been experiencing the same thing. And we have been complaining to the right appropriate team to go and try and enforce this. And those are the risk communication. They're supposed to be moving to all this, whether it's private and government establishment, to make sure these non-pharmaceutical measures are strictly adhered to. If you can recall, even before, even the wearing of face masks by majority of people, it was a challenge. It was when the security agents are drafted to the street that we start seeing people wearing face masks. I think it has reached a level that government have to start enforcing those non-pharmaceutical measures, even at the government establishment, so that they will serve as an example. They have to lead by an example, because you can't be campaigning to ordinary people to follow certain procedure, and when they go to government establishments, they are not strictly being followed. So this is very unfortunate, and I think government is listening, and they are likely to do something about it.
If you're just joining us this morning, we're talking about myths, misconceptions, and the COVID situation in Kaduna State, and of course, nationwide, with Dr. Ibrahim Jimoh of the Department of Community Medicine at the Barrow Dikko Specialist Hospital. And he is also a consultant public health physician. We'll be right back after this timeout. Stay with us.
We'll be right back after this quick commercial break.
Victor FM.
Thank you for staying with us through those commercials there. Still on the program Perspectives with Dr. Ibrahim Jimoh of the Department of Community Medicine at the Barrow Dikko Teaching Hospital. He's also a consultant public health physician. Dr. Jimoh, great to have you with us still.
Thank you.
Now, before we went on that break, we had talked about several things. You had even mentioned some of those places where one can get recognized, testing within the metropolis. But there was a question I think I should have also asked, and I'm asking it now, which is how long should the results take? Like, how long does it take for you to get your results after the testing? Because quite a number of people have also asked about this, because you go there, you think it's an immediate thing, and it's not happening that way. So how long does it take?
Ideally, the results will come out within 48 to 72 hours. But we are having some challenge recently because of a little big high turnout of people. So the result is lasting about 4 days or 5 days before it comes out. That's what we are experiencing recently. But ideally, what we used to have before is between 2 to 3 days, actually.
So how would you handle people, for instance, who want to travel out, who have been told that your COVID result or your COVID test must not be later than, I think it's 72 hours,
yes.
About 3 days. You must not take that test less than or more than 3 days before you travel. So how do you handle people like that?
I think we have issue like that, and we are giving them opportunity. I mean, try to attend to them because we know result after 72 hours will not be accepted at the airport. So we are giving special consideration to them. So for them, no problem.
So this would mean how do they get across? Do you, when you walk into the test center, do you say, look, it's not because I'm ill, but I need, this test result because I'm traveling?
Yes, they normally inform us because they need to collect the results before they go. So they normally inform. It's not everybody will give results. If you must give you results, you must have tangible results. And most people will normally give results those people that are traveling out, that they have to ask. And because of that, they tell us when they are traveling. So we take all those into cognizance when we are doing the test, so that the result will not be the problem before. Issue of the result will not be a problem before they travel. So we are taking care of that. That one, there's no problem.
So if we're having trouble now, if we have more people turning out to for testing, because a program like this, sensitizing people, we've heard that, look, do not depend on the old symptoms. Do not think, oh, I have to have a cold or I have to have some chesty or respiratory symptoms first before I start to think along the lines of COVID. If you are feeling like it's malaria or even typhoid, for some people it might even be tummy ache. Just to err on the side of caution, go and get yourself tested. So hopefully we will be seeing even more people coming to you now for testing.
Yeah.
If we're already having problems about the slight spike in turnout of people who have come for testing, and it's causing, a delay in people getting their results, there's a backlog. How are we going to handle people in out more for tests?
Yes, we are. Every day we are strategizing and re-strategizing to overcome this kind of scenario. In fact, there are times we have to take sample to Kano for us to be able to meet the deadline when our labs are overwhelmed. So we are strategizing and re-strategizing every day to overcome this challenge. So the people should not be worried. The government is handling the situations in a manner that we improve the efficiency of the work. So there's no problem. Government are equal to the task, and the test kits are available, and the people are up and doing to make sure results are released as early as possible.
Are the tests different? Do we have different types? Because for some people, they will tell you that especially those who travel, that look, when we get to some countries, tests are done, at the airport, and results come out in, say, like 30 to 45 minutes, and where it is only then that you are allowed to leave the airport environs. So do we have different tests, or how are these other people testing?
In Nigeria, we only have PCR test, which is polymerase chain reaction test. That's what we are using in Nigeria. But we realize that in some countries, they use what we call rapid diagnostic test. And we realize the rapid diagnostic test is not reliable. Absolutely. So because of that, and we don't want a situation where we'll be having false positive or false negative. The most reliable test when it comes to COVID-19 is PCR test, and that's what we are using in Nigeria to make sure whatever result we are released is of quality and we can guarantee it. We don't want to gamble because there are some people that they will say is positive. They may actually, when you do PCR test, they are negative when you use this rapid diagnostic test, and that is why Nigeria have not adopted that type of test up to now.
Okay, so it's good that we cleared that up. Now let's move to what, the hope of the world, talking about the vaccines. A number of countries have received some vaccines. Nigeria has received some, or haven't we? If we haven't received, what exactly is our situation as regards the COVID vaccine?
Yes, the government is still seriously planning on how to get about 100,000 doses.
100,000 doses?
Yeah, to start with. After which, the subsidy, that's what they've ordered for, but it has not arrived. And their target is for those at high risk, the health workers, the elderly, people that are having chronic diseases that are that can compromise their immune system. So those are the kind of people the government is just first targeting, so that we'll be able to reduce the number of deaths as soon as possible, because health worker is highly infected and they are vulnerable because people come to hospital to seek for health care, and as a result they get infected. So as a result, that's why they are put at high risk. Then what I want to add concerning vaccine, even with vaccine, people should know that we still have to continue with these non-pharmaceutical measures, preventive measures, because vaccine can only prevent you from developing diseases. It cannot stop you from being exposed, and it cannot stop you from being infected. So which means you can be, when you are vaccinated, you could be an healthy carrier. So you can be okay and be carry the disease around, infecting others who have not been vaccinated. And that is why even when you are vaccinated, you still have to be putting on your face masks, maintaining social distance when you are in a crowd, and as much as possible, regular hand washing, so that you don't transmit the infections to others. That's what I want people to know. So we should know these non-pharmaceutical measures is a new style of behavior we have to adopt. And it seems it has come to stay. That's a new style we need to adopt, and that is how we have to continue for at least, we don't know, for recent time.
It's a frightening picture there indeed. We must take these non-pharmaceutical procedures very seriously, because if we are just struggling to try to get just 100,000 doses, even those 100,000 doses, I dare to say would not be enough even for our health workers. If one had to, take account, I don't really have the data, but all across Nigeria, our health workers, I'm sure, must be more than 100,000 before we even start to consider those who are of age and might have the kind of symptoms, the kind of conditions that would make them more susceptible to developing serious or fatal complications of this disease. Well, it is time for us to open up the phone lines so that you can directly speak with Dr. Ibrahim Jimoh in the studio this morning. And the lines are open. Our numbers are 081 40,000 989. Once again, that's 081 40,000 989. Then we also have 070 87 800 989. That second number, once again, is 070 888-800-989. Let's go take your calls now. Hello, good morning. Hello?
Hello.
Yes, we can hear you now. Good morning.
Good morning. How are you?
We're doing great. Thank you for asking. Your name?
Yeah, I'm Luka Adwa Malabarido.
You're welcome. Go ahead with your question.
Yeah, I think with the number of doses about to be fired for Kaduna.
Sorry? I didn't get you.
The government.
Your line isn't clear. Maybe you might want to try again. We couldn't hear you. Still taking your calls this morning on the program Perspectives. Hello, good morning.
Hello.
Good morning. We could hear you actually. I think the network is playing up once again, but let's take another call. We have another call coming in. Good morning.
Hello, good morning.
Good morning.
Yeah, thanks so much for your this information. From
Your name,
my
please?
experience, I understand that even biological...
Introduce yourself, sir.
Yeah. Pardon?
Please introduce yourself.
Okay, I'm Solomon. I'm calling from Higher Banking.
Okay.
Yes. I noticed that Barodico is also running tests on this COVID-19. So we want to know if this arrangement will also be done in some other institution besides Barodico. And we noticed that theirs is free of charge, which is a good development from the government of Kaduna State. But we don't know to what extent this arrangement will be done so that others from different parts of the state can also benefit from this arrangement. Thank you.
Okay. So we're talking about other centers to have more spread of these centers within the state. That's from Solomon, I think. Let's take another call. Good morning.
Good morning. I'm just speaking with Mariam.
You're welcome, Mariam. Please, Mariam, you need to turn down the volume of your radio.
Okay, I just did that right now.
Okay.
Yeah. Good morning.
Good morning.
My question here is that, the PCR test, because I'm coming from the Netherlands, I came on holiday and I'm in Kaduna State.
Okay.
And I did the PCR test in the Netherlands. And after 7 days, I have to I don't have a branch check Kaduna while I was filling my form through online.
Mariam, please, could you speak up? You said you came in from the Netherlands. You did your test.
Yeah, I did my test before coming to Nigeria, which I have to repeat it after 7 days.
Right.
But the problem here is that they don't have a center here in Kaduna while I was filling the form online. So I have to go back to Abuja. Even right now, I'm about to go back, but I'm still going back to Abuja for the test before flying back. So what I want to know, if they have the opportunity where I can do it here in Kaduna, that would be better for me. That would be the test result.
Yes, test centers. Is it a particular test? Is it not the COVID PCR test we're talking about?
Yeah,
we have PCR tests in Kaduna. If you go to Barao Teaching Hospital, it can be done. If you go to Yusuf Daso Hospital, it can be done. If you go to Rigasa General Hospital, it can be done even within Kaduna Metropolis.
Okay, but how soon can I get it? Because they're asking for 72 hours. That's within 3 days you have to do it.
If you get there, inform them that you are using it for traveling. They will do it, and you will get the result on time because it will give you people special consideration.
Mm-hmm.
Okay, which day is probably the best? Because I'm leaving on 29. So should I come on 27 or what do you advise?
Yes, I advise you to go on 27 and explain to them, please.
Yes.
Because people are many. Explain to them. Yes, they will help you out.
All right. Yes. Thank you for your information. Have a wonderful day. Bye.
And thank you too, Mariam. Let's go take other calls this morning. Hello, good morning.
Hello, good morning.
You're welcome.
Yes.
This
is Mr. Nankar.
Mr. Nantar.
Yes.
You're welcome, sir. Go ahead.
Yes, Doctor, I agree with you also.
Thank you very much.
Please, anything with asking questions, you can make someone to be understand clear. I have something that is going on, issue of COVID-19. I observe how this country is going on. Doctor, due to your own explanation, like between last week Saturday, local government election was conducted in Kano State. While federal government are giving us the order, the crowd is not allowed. For the mosques and church, markets it's not allowed. When anything is coming in like election between government, they are conduct that election without any rule, without any fear of this virus. You won't tell me that this virus is not dealing with anything concerning politics or election. That is why some of the people are doubting up to now for this issue.
Okay.
Number two for my question, Dr. Wade. Number two for my question.
Okay, so let's make it quick, please.
Okay, number two for my question, then lastly. Now, as Mr. Lenker now, you cannot order me to touch away from the danger. The Nigeria one, they are forcing them to touch away. Are we not human beings all our life is not a life? This thing, honestly, is contradicted for me. Thank you.
Okay. And so he finds contradiction. I didn't get what he said last, but he did talk about, elections that took place. And yes, and you're talking about, we need to maintain social, or should I say physical distance. And here we are doing everything to lump people together. As a matter of fact, I'll make bold to add this NIN registration also as one of the policies that came at a time when, you're asking people to stay away from each other as much as possible, at least physically. And here you are asking people to go register where they're going to be lumped together like sardine. And so how would you respond?
Yeah, thank you very much, Mr. Nanta. It's also a source of concern to us, but what we must understand that there's what we call constitutional issues. And when election is due in any part of the country, it has to be conducted. Otherwise, there will be what these legal people call constitutional crisis. But at the same time, we must be able to balance the two. An election can be conducted without being crowded, and people can still maintain these non-pharmaceutical measures like wearing of face mask, maintaining certain distance. If the government will be able to enforce that, what the constitution the running of the governance, act of governance have to continue. Otherwise, asking government to stop governance, there is like we are looking for anarchy. So my own advice is anytime government want to conduct these kind of things, they should put people that will enforce the way people will arrange themselves in such a manner that they will not be a source of spreading the infections in that locality. That's just my own advice. And this thing is happening in Kano. At least recently, America, where is the epicenter of this COVID-19? They had election was held. And life have to go on. And as I've been saying, we don't know when this thing will end. We have to find a way, find the middle ground, how we'll be able to conduct our activities. And at the same time, people are maintaining the healthy behavior. That is the way out. If you now say because of COVID-19, everything must be granted, we are looking for a crisis be that. Because all this hunger will continue and the economy is in the doldrum. People have to, that's why government didn't even consider the second lockdown, despite this second wave, the second wave of COVID-19. That's why they are not, because the economy is down, they are in recessions, and people are shouting of hunger, and you have those kind of people to stay at home. But we can still conduct these activities within a measure that will be able to protect ourselves so that our lives continue, because we don't know when COVID-19 will end. And the same thing applies to name registrations. Government are doing it for purpose. They are shouting insecurity everywhere in the countries. And they want to know ourselves, be able to track individuals wherever you are. So what they need to do is to try to strike the balance between the two so that it will not be a source of infection to people going for. And government have come up with policy using what they call booking systems. And we are seeing some pictures showing that there's an improvement in terms of number of people gathering at each registration center. I think that's just what I want to say concerning this. Thank you.
Okay. Are you done answering all the questions that you wrote down?
Yes.
Okay. So we answered Miriam and Mr. Nanta. Okay. If you just joined us, I certainly hope not, because we have been talking about some pretty important information as concerns coronavirus and how it affects us, what are the new developments. And I'm glad that a person like Miriam, who came in and would have found herself on the way to Abuja to go get tested, got credible and, important information to her this morning on this program. I would like to thank you, Dr. Ibrahim Jimoh, for coming in this morning. Dr. Ibrahim Jimoh is of the Department of Community Medicine at the Barrow Dikko Teaching Hospital. He's also a consultant public health physician. My name is Jacqueline Adebija. You've been listening to the program Perspectives. Have a victorious day.
Today's hit music. Victor FM.
We'll be right back after this quick commercial break.
Are you serious? For real, are you serious? Victor FM.